When first looking for a hair transplant, I would come across two different types of videos generally. So you'd have the FUT videos of people saying the strip method, this is the way to go. But then you have these FUE companies, surgeons who do FUE surgery, saying, oh, strip is bad. The FUE is the only, no scar and all this type of thing. And there's these two big battles going on. I think this is one of the most frustrating parts of me choosing a surgeon and choosing a type of procedure, was these two different factions butting against each other like head on. And so you do both FUE and FUT, but you more often perform the FUT. And can you tell me why you do that, and why there's this faction, the FUE faction, that's saying, oh no, anytime you hear the word strip or strip method or FUT, that's bad. So can you give me a little bit of information?
Certainly. Well, I think there have been some misconceptions that have been blown out of proportion in the industry. I use the example of flying on Southwest Airlines, and you see these advertisements in the advertisement book there, and they show this terrible before and after scar, and they show and the truth is, when you're doing a strip procedure, that it's actually the exception, not the rule, that you would end up with scarring like that. When you do it properly and the procedure's performed properly with proper closure techniques, typically you get a scar that I'll challenge my hairdresser or an individual's hairdresser to find. It really is and anyone that tells you that any surgery, whether it be FUE or strip, is a completely scarless procedure is just not being sincere, and they're not being honest. I could show you plenty of patients that when you clip their hair down, it looks like they got shot by a BB gun in the back of their head because they've tried to over harvest with FUE. Mm-hmm. So getting the facts straight, I think, is important. I think there's some overblown fears about the strip procedure. The truth is, that is what many of the machine industry promoters have tried to capitalize on, is capitalizing on people's fear. The truth of the matter is, if you're looking at hair restoration surgery, hair transplant surgery, what are we trying to accomplish? Are we trying to accomplish where you get as much hair as you possibly can, you get the best cosmetic result that you possibly can, and you do that at the expense of not having any scar at all? Well, that's just not realistic. Can there be scarring with either procedure? Absolutely, there can be scarring. However, I'll throw this out at you, to the audience, and see what you think. And you ask me, why is it we do more strip procedures, if you will, with the ultra density than FUE? The simple answer to that is, when I sit with my patients and I explain to them the pros and cons of both procedures, they're the ones that choose. Well, you mean I can do that and get more hair, I can get better hair, I can get better quality hair, and if there is any scarring, you can come back and you could do a small little FUE procedure and cover up the scar if necessary, and you won't charge me for it? That's kind of a no-brainer.
Yeah.
So where is the real need for a patient having an FUE when you're going to get more better quality hair with a larger harvest procedure? And the simple answer is, when it is appropriate, when a patient comes in and for whatever reason, maybe they've had a couple of procedures before, maybe they don't have any elasticity in their scalp, maybe they're just a better candidate for FUE and they only need a small amount of hair to be transplanted. Great, I think that's perfect indication for it. But a lot of these facilities that only provide FUE, all right, I'll just challenge you. Show me your results. Let's see a dozen before and after photos of FUE patients with real good density. I usually don't see it. So you cannot replace the fact that you need a lot of good hair to really make an impactful change with this procedure.
I think people don't realize as well, before and after, photos and videos can really be doctored a lot,
Yeah.
I mean, they can. So one of the best things that you can do is really to just, and I'm sure Dr. McGrath would be interested, happy to give you phone numbers of other patients that he's worked on. Really meeting one of them in person, I mean, that's the best thing, right? Then you really see for yourself, but being able to talk to them on the phone, people who have no agenda but had great results done. The other thing I think is very cool is the fact that actually Dr. McGrath does the FUE procedure, and he will actually do that to fix the scar, for free. So if after 16 months, 12 months after you've had your procedure, if you're not going to get any other work done, he will actually go in, and for no extra cost, which as far as I know, there's no other doctor in the world that does this. For no extra cost, he will go in, do the FUE, take just a bit of hair. It's a little bit less intensive or a lot less intensive of a procedure, and actually fix that and fill in that line, so that it's totally a scarless surgery. So that's pretty awesome.
And I think an important point to make, which is going to sound a little bit like I'm tooting my own horn, but I want David to ask the question. Why don't you ask me, since I've done that, and doing FUE, and of course doing strip, and explaining to patients the difference, how many times have I had to come back and actually offer a patient that option? How many times have I really had to do that on patients that come back and go, oh my goodness, this scar is terrible, I need to have something done to fix it?
Probably,
I can count on one hand.
Yeah, probably. How many times have you actually had to go in and fix the scar because it was bothering people?
2 or 3 times.
2 or 3
maximum.
Times. Yeah.
But I'm happy to do it. If that's what it all hinges on, I say as a surgeon, well, why wouldn't I just take that fear factor out of the equation altogether? Because in my opinion, most of the patients that end up going forward with doing FUE are doing it because they're afraid.
Yeah, for sure.
They're afraid that they're going to have this monster scar. And I'm here to tell you straight up, right now, face to face, that just is not true. It is not true. That is not the norm. But we've been sort of manipulated, and that's not unusual in media these days, that your mind can be manipulated one way or another. Really, what we're looking for is good quality results. If I think a patient's a better candidate for FUE, they're going to get FUE. If I think honestly they're a better candidate, we can move more hair, we can do it with better quality hair, I'm going to recommend ultra density and do the strip process and explain it to the patient and not try to push them into a corner to do it. We'll do both, fine. But once they're educated and they see before and afters and they understand the process, it's the patient that makes the decision and says, yeah, that makes so much more sense. And it does.